Y'all give it up for the legendary Cody Carnes.
Christ is my firm foundation, the rock on which I stand, when everything around me is shaking. I've never been more glad that I put my faith in Jesus, 'cause he's never let me down. He's faithful through generations. So why would he fail now? He won't. No, he won't. No, he won't. No, he won't.
I still got joy in chaos. I've got peace that makes no sense. And I won't be going under. I'm not held by my own strength. 'Cause I build my life on Jesus.
Welcome to Jewel's Leading Light Special Educational Needs Department, a place where potential is nurtured, voices are empowered, and every learner's progress is celebrated. In the next few minutes, we'll take you on a brief journey through the key areas that define our commitment to inclusive education. At Joel's Leading Light Special Educational Needs Department, one thing remains constant: our belief in every child's ability to grow, learn, and shine in their own unique way. Together, through our tailored therapeutic regime and activities, we are not just supporting learners, we are unlocking potential and empowering futures. Thank you for joining us on this journey.
I am Oyinloye Shola Aderemi. Precisely last year, David joined your school, and the major problem I was having was, will he write? Will he stop using diaper at the age of 5? And it's a major concern to me, which I keep crying out to God every day that let me have a solution to all these problems. And there comes my solution, who happens to be Jewel Leading Light Academy. The very first day he came into the school, he was so happy. I was so scared. And he came into the school with the diaper. And the second day, the message was in his bag that kindly bring him to school without diaper. I was like, oh. I thank God that I obliged to that, and it happened. It worked. It worked out. But the very first day, David could go out without a diaper, and he came back without him defecating in his body, and I was so happy. It went on through like that for a week, from a week to month, from months to a year. And at home, David could sleep without diaper. He could do things that way back then he could not do. David could walk, David could stand, David could pick a pen. A pen and paper were his nightmare way back then. But David could see pen and papers right now, and he could write from 1 to 100 to 200, now to 700, which is more or less like a miracle to me. The achievement, the growth, the strength from Jewel Leading Light Academy is uncomparable to other schools. I'm not advertising, but I'm speaking from fact and reality of what I've witnessed in Jewel Leading Light Academy. I don't have much to repay the school back in a way to tell them thank you, rather than to come out in public and say thank you, Jewel Leading Light Academy. Thank you, and God bless you.
My name is Deborah. I'm a mother to Crown Bedroom. He joined the school about a year now. The improvements I've seen have been tremendous. The vocabulary were like just, let me say, 5 words, 5 to 10 words. But now his vocabulary has increased, his speech, his interaction with his peers and other people at home. So socially, he has become more outspoken and confident. And academic wise, he started reading, he started writing gradually. So those were not there previously, and then he has really improved.
Progress is something else in terms of speech and in terms of being able to organize himself and focus to do something. In terms of tracing, you discover that he has really changed. Patience to trace wasn't really there. You can just do like this and throw away the pen and then run away. But now, you know, when he gets home, he brings his assignment for us. Yeah. I don't know how you guys did it. He's more interested in terms of academics, unlike before. So I must appreciate God for this school. Nice knowing this school. Pains me that I really did not know this school before now. We are running from pillar to post, seeking for help. I say Philip has improved tremendously. Oh, my son.
Good morning, good evening, good afternoon, wherever you're joining us from. Welcome to this Juice Leading Light Schools Autism Awareness Virtual Summit. We're so honored to have you join us today, and we do not take your presence for granted. Today is not just another event, it is the gathering of hearts, mind, and shared commitment towards building more inclusive and supportive world for every child. At Juice Little Light Schools, inclusion is not just a concept. It is our culture, our practice, and our everyday reality. We're proud to be a school that embraces every child, irrespective of their peculiarities, learning differences, or individual needs. We believe strongly that every child is capable, and when given the right environment, the right support, and the right people, they will not only learn, they will thrive. This belief is reflected in the understanding progress and transformation we consistently see in our learners. And this would not be possible without our dedicated therapists and highly skilled SEN educators whose passion, expertise, and commitment continue to produce remarkable results. Now, beyond today's summit, we are even more excited about what lies ahead. We will be hosting a 2 days intensive master designed class to equip, empower, and transform how we support our children. And here is the beautiful part. The master class is not just limited to certain parents alone. It is open to all parents because every child at some point needs guidance, understanding, and the right strategy to succeed. This session promises to be a game changer. And during the summit, our esteemed executive director, Mrs. Oluwatoyin Obo, will be giving us a sneak peek into what we can expect today. Trust me, you do not want to miss out. Now, to ensure that today's event flows seamlessly and that we get the very best out of each session, We want to have we want to ensure you have a remarkable time with us. So I'll have the singular opportunity to bring up someone very special to us. She is a holistic health expert, a seasoned professional, and a passionate advocate for balanced living and total well being. It is my absolute pleasure to introduce to you Mrs. Modupe Ayegbese, who will be taking us through most of today's event. Please, if your hands are not too busy wherever you are, please put your hands together as I make welcome Mrs. Modupe Ayebusi. Over to you, ma'am. Should I go up? Okay, so can you please drop on the chat button? Let's get to know where you're watching from. Let's get to know where you're joining us from, please. Okay, Mrs. Modupe Ayebusi is here.
Hello, can you hear me?
Yes, we can hear you. You're welcome, ma'am.
Thank you so much. Thank you so much. Good evening, everyone. We're hoping for an amazing, hitchless evening, with our wonderful technology. God help us. It's great to have you all here. I am Modupe Ayegusi, the founder of Maze Holistic Health, and it is my pleasure to welcome you today to our summit. So I'm going to say good evening, good afternoon, good morning, everybody. I hope you're excited. We have a range of amazing speakers today. We have amazing speakers, and I can't wait for you guys to hear what they have in store for you. Thank you so much for welcoming me. I want to welcome our dear parents, our caregivers, our educators. You all are the reason why we do what we do. Thank you so much and welcome. It's truly a privilege to moderate this impactful gathering for Jewel's Leading Light Autism Awareness Virtual Summit 2026. If you're excited, let me know in the comment section. Come on, let's light up the comment section. If you're excited for what is coming today, this year the theme is both powerful and thoughtful, and actually very thought provoking. Beyond awareness, advancing understanding and acceptance and inclusion. I mean, those of us that have children on the spectrum, you know how important this is. Now, awareness. Oh, I see people. Welcome, 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 Esther Gabriel. I can see you. Sorry if I'm not calling your name. I'm just excited that you're here, and I want us to dive in. Like, our speakers have been online and they are waiting. So welcome everybody. It's so good to be here, and it's so good to have you here. This year's theme is powerful. This year's theme is titled Beyond Awareness, Advancing Understanding and Acceptance in Inclusion. All right. Now, awareness is important, but awareness alone is not enough, right? So we must move beyond simply knowing about autism or knowing about, you know, behavioral issues, and we must go into learning the differences, truly understanding the unique needs of every child. This is very important. We want to go into accepting every child without any bias or any limitation. All right. So it's with great joy that I welcome you into this inclusive environment where we begin to learn about our children. All right. So let's see. The theme calls each and every one of us, parents, educators, caregivers, and professionals, to action. It challenges us to reflect, to grow, to become more intentional in how we support children entrusted into our care. I hope you're ready for this. And today, through the insightful sessions lined up for us, we're going to be exploring practical ways. This one is not theory, it's practical ways to make this a reality. At this point, to officially declare this summit open, it is my honor, it is my privilege to welcome the passionate advocates for inclusive education in Nigeria and in the world, a woman whose commitment to transforming lives through education is truly amazing. She is the executive director of Jules Leading Lights Academy, group of schools. Please join me. Put your virtual hands together as we welcome Mrs. Oluwatoyin Obo as she gives her welcome speech. Welcome, ma'am. It's so good to have you here.
Hello, 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 hello. I don't know who is as excited as I am. Thank you, Dr. Modupe, for that wonderful introduction. It is such an amazing, amazing opportunity to be able to reach out to a whole global community where we are able to lend our voices in respect of the autism awareness. So welcome everyone. If you're excited, let me see the emojis. Welcome, welcome. Welcome, distinguished guests, parents, educators, caregivers, and valued stakeholders. It is with great joy and deep sense of purpose that I welcome you all to this year's World Autism Awareness Virtual Summit, hosted by the Jules Leading Lights Group of Schools. This year's theme is Beyond Awareness, Advancing Understanding, Acceptance, and Inclusion. And this calls us to a higher level of responsibility. It challenges us to move beyond simply acknowledging differences to truly understanding them, embracing them, and creating environments where every child feels seen, supported, and empowered to thrive. I want to welcome Dr. Zainab Yaro, Dr. Omolola Okewo, Mrs. Modupe Ayegbusi, Dr. Oluwakemi Adediran, and Mr. Praise. Thank you to our speakers who have created the time to lend their voices from their expertise so that we are able to create practical strategies and also create the awareness where support can be given not just to the parents but also to our larger community. At Jules Leading Light Schools, particularly within our SEND department, our mission is clear and unwavering. We are committed to empowering learners with special educational needs through structured therapeutic programs, inclusive practices, and individualized support systems that nurture excellence, build confidence, and develop resilience. Rooted in our Christ-centered values, we are intentional about equipping every learner, not only for academic success, but to thrive holistically, to lead with purpose, gain an independence, and to make meaningful impact in their generation and beyond. You know, this mission is more than a statement. It is the driving force behind all that we do, behind our vision. It shapes every decision we make, informs every program we design, and guides every interaction within our school community. And so that is why we are passionate about inclusion. We are privileged, like I said earlier on, to have an array of seasoned professionals who will be enlightening us on the various facets of inclusion. I need you to get your pen and paper. I need you to invite everyone, every parent you know, every educator you know, every minister you know, every mom you know, everybody must be here to lend their ears, because one out of every 10 children actually needs some form of support or the other. I'm seeing in the chat people who are joining from Maiduguri. We love you. From Kubwa, welcome, 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 welcome. I want you to know that even if this is a free session, it has been sponsored. And so also thank you to all our sponsors who have made today possible. I'm hoping that at the end, each session will bring to you the equipping with the knowledge, tools that you need to make inclusion not just an idea, but a lived reality. So welcome everyone once again. I'll quickly just give you a brief introduction into what will be coming up at the end of April. It is our masterclass called From Struggle to Strength. I'm not going to be saying much because we have our professionals who have come loaded. They are waiting to just explode. And I know that you're all going to have an amazing time. Oh, wow. We have someone from Port Harcourt. We have someone from Abia State. Wow, wow, wow. Well done. So later on, I think about April, the flyers will go up. I would like the team to put up the flag. We're going to be having a masterclass, and I'm going to be just be giving you some snippets on what the masterclass is all about. You can see it scrolling. It's going to be on the date April 24th and 25th. It has become necessary because as a school educator, practitioner, we have found out that a lot of our children actually need support in developing holistically, not just talking about academics. So when you join this masterclass, it's going to give you, it's going to enlighten you on the different ways and how you can practically support your child or children. Yes, so that is it. It is displayed on the screen, our virtual masterclass, and I want to encourage everyone to make sure you take advantage of the early bird. Make sure you subscribe. And do you know what? What a great way to celebrate Easter. You can gift this virtual masterclass to any parent, anybody that you truly love. If you truly love that parent, that sister, that cousin, that aunt, please, 5,000 naira is not anything too much. Okay, now we're going to quickly go into a snippet of what we'll be going to do, and I will tell you something. I always say this is our mantra in Juice Leading Light. Every child can shine, and every child can thrive. We don't believe that we believe that with the right support system, a child will bloom and will fulfill their potential. It's important that we understand that every child faces one challenge or the other, especially now in our digital world. We're even having digital autism, we're having so much. But the thing about this thing is not just to talk about the problems, but to understand that every child deserves the opportunity they need to succeed. And this journey is not just about helping the children, in terms of transforming their struggles into stepping stones for growth, but also giving the parents the sensitization, the tools, and the awareness. So that once you're going into, maybe your child has to go into Sunday school or has to go into the, sorry about the noise. So, technical crew, can I go ahead? Okay, all right. So sorry. Okay, so when it comes to your child, maybe they have to be enrolled maybe in an extracurricular club or an Islamic club or a Bible club or even the school. It's very important that you know your child through and through. Your child will thrive better when you are able to come up with a dossier. You go in and say, this is my child. Usually it's the reverse that happens. So what we see happen is that teachers are telling parents, this is who your child is, or this is the support that your child requires. And parents are in denial because they do not really understand the signs, nor do they really know what is happening. So when we talk about understanding struggles, we want to look at certain struggles. We have like the academic challenges. This is going to expand further in the virtual masterclass. And this one has to do with maybe difficulties with reading, writing, attention, or keeping up with school work. We also have the emotional and behavioral struggle. The emotional and behavioral struggles. And this one has to do with managing emotions, frustration, anxiety, or behavior regulation. Trust me, this one has become something else. We're having a lot of educators who are leaving the profession just because of this one. A lot of educators are leaving because at home, parents are not able to provide emotional and behavior regulation. And now the educator is trying to do that. And the next thing that they are hearing is, you hate my child. You do not like my child. Parents and school must come into a strong partnership. And then the therapists, in the case of children who are on the spectrum, there must be this synergy. We have to understand that no educator has anything to gain, neither any school, from labeling your child or not liking your child, as we normally say in quotes. The next thing we're going to be looking at is also we're having a lot of children who are suffering with confidence and self-esteem. So we have children who are doubting themselves, their abilities. There's a fear of failure. There's low self-worth. So you see, when we are talking about, understanding children's struggle, we're not just talking about children on the spectrum, but we are trying to make you realize that every child has a need in one way, area or the other. Now, there's a very high rise with children who are becoming so there's a lot of cutting, there's a lot of trying to attempt to kill themselves. All of this is what we are going to be looking into. Another struggle is the social and peer related difficulty. This one, oh my God. because children are not going out to interact as they're supposed to, there's a lot of fear, insecurity, and all of that. And then we have a lot of children who are spending more time on games, which is screen in any form. We're having a lot of children who are struggling with their social skills. So they're not able to communicate effectively. And I don't know if you've noticed, we're also having children who are having issues with honor. There's a lot of disrespect, and it's not intentional. So there's an acquired global culture. Parents and caregivers and educators, we have to be intentional about the values that we want to retain in our learners or our children. So this we are going to be looking at come April the 24th and the 25th. I'm not going to go further. I'm going to stop here. This is just to whet your appetite. I need you to enroll as quickly as possible because we are going to be fleshing this out. How can we raise children that will survive these times, that will survive this VUCA world, that will grow and become, and bloom and be able to maximize their full potential? I'm going to be talking about this later if we have more time, but because we didn't start on time, I've had to cut short my presentation so that we can make up with time. So welcome everyone. Welcome, welcome, welcome back. We're going to be running a very short sponsorship and then the next speaker will be coming up. Are you excited? I hope you're excited. Welcome. And we trust that a lot will be unfolded today. Make sure you wait for the panelist session. That one will be a goes bass. You're going to be taking all your questions, and that will be answered during the panelist session. So thank you, everyone, and welcome. Welcome.
In the heart of Abuja, Nigeria, Jewel's Leading Light International School stands as a beacon of excellence, deeply rooted in Christian values. Our school offers a rich blend of British, IPCs, EYFS, and Nigerian curricula, ensuring that students receive a globally recognized education while embracing the moral foundation of the Word of God. Our state-of-the-art facilities, from science labs to top-notch sport amenities, are designed to create the perfect environment for students to learn, grow, and thrive. We incorporate the advanced teaching technologies to make learning both engaging and effective, fostering a nurturing space where every child feels inspired and motivated. Jewel's Leading Light is more than just a school. It is a community dedicated to nurturing the trailblazers of tomorrow. We are committed to cultivating the next generation of global leaders and innovators through rigorous academic programs and a Christ-centered approach, ensuring excellence and creativity in all we do. Join us at Jewel's Leading Light International School, where we are dedicated to nurturing the trailblazers of tomorrow.
Okay. Thank you very much, Mrs. Oluwatoyin Obo, the director of the Jews Leading Light Group of Schools, for that inspiring and insightful address. We truly appreciate your leadership and unwavering commitment to inclusion and excellence. We will now proceed to the next segment of our summit. We will begin to unpack today's theme through our distinguished speakers. Our next speaker will be setting the tone for today's conversation. Our first session is titled From Awareness to Action: What True Inclusion Really Demand. This topic speaks directly to our theme, challenging us to move beyond passive awareness to intentional, practical inclusion. It is my pleasure to introduce to you all Dr. Zainab Adamu Yaro, who will be taking us through this session. Please, if your hands are not too busy, let's have a virtual hand clapping wherever it is you're watching
Dr.
us from.
Zainab Yaro, is a medical doctor, autism and behavior specialist. She is a passionate child and special needs advocate. She is the medical director at Dr. Mims Clinic and Wellness, a pediatric hospital which offers a holistic approach to every little human's medical needs, with a focus on preventive health and intervention services for children with neurodevelopmental conditions like autism, ADHD, cerebral palsy, etc. She is the founder of Saving Little Humans with Dr. Mims. She is also the author of My Little Human's Personal Health Record, a journal and guide on caring for children from birth to 5 years. She is the co-founder of Progeny Cerebrum, a unique mentorship community for medics in training. Let's welcome Dr. Zainab Yarrow.
Hi, Dr. Zainab. You're welcome. It is an honor to have you join us. Can I be
Hi,
heard?
good evening.
Oh, good
Yes.
evening. You're welcome, ma'am.
Can you see me?
Yes, I can
Okay.
see you.
Okay.
Yes.
So good
It's your
evening.
time, ma'am.
Okay. I don't know if my slides are coming up. Okay. So good evening, everyone. Thank you for having me. And welcome to the new month of April. And today, the theme of, I think, what we're talking about today is about awareness and how we can move from awareness to action. So I'm hoping that by the end of today, everybody will be challenged to, go beyond just awareness, just knowing, to actually understanding, accepting, and then the most important bit of it is action. And before, the start of this, I was speaking to one of the organizers and I was asking if anybody was taking any part that had to do with talking about what autism truly is, because we don't want to assume that everybody that is joining us today understands what autism is. So he said one of the speakers will be talking about that, but I feel like to set the tone, I'll just gloss over briefly what autism is so that everybody is carried along. So next slide, would I be able to control this from here? Okay, so what is really autism? We hear about autism, it's being thrown around, So basically, autism is a neurodevelopmental condition. So anything in medicine that says neuro means the brain. So when you hear neurologist, neurogenic, everything neuro means the brain and how the brain works. So obviously, developmental has to do with how a child goes from being born to adolescence into adulthood. So autism is a condition that affects how the brain works, and that affects how a child develops from birth up until the child grows. So there are different aspects of a child's life which autism can affect. So we're talking communication, and that's why there's a certain criteria that a child has to fulfill before you make a diagnosis of autism. So there has to be a problem in areas of communication, how the child interacts, tries to express his feelings, or how he perceives other people communicating. So we're talking expressive and receptive. Then behavior. We're looking at different aspects of the behavior in terms of certain restrictive behaviors we might see, a child wanting a particular toy, wanting things to be a certain way, being very attached to certain routines. And then we're looking at repetitive behaviors as well in terms of maybe movement or speech or sound, they tend to flap their hands or like to spin in circles, just repetitive behaviors that ordinarily you would not see in a little human. And then lastly, social interaction. So it's not just in terms of communication, because you can have a child who is communicating, but then not having that social interaction. The whole idea of speaking is to communicate one's feelings and one's needs and wants or how they feel. So there can be a problem in social interaction, in how a child relates with his peers, whether he plays in isolation, how a child is able to share a toy, just basically things like that. Next slide. And most times you hear autism, you don't hear you hear ASD, so autism spectrum disorder. And it being a spectrum disorder means that it can affect people in varying levels of severity. So this means that each person with autism has a distinct set of strengths and then challenges. So the way in which people with autism learn, think, and problem solve can range from highly skilled to severely challenged. And some people with autism may require significant, support in their daily lives. So we're talking level 3, and others may need less support, and in some cases live entirely independent, and that's level 1. So that's why it's called a spectrum, and that's to remind everyone that once you see one child with autism, you've not seen all of them, because they have a distinct, area of how they present, how they live their lives, and the kind of support that they need. Next slide. And then, now we're beginning to hear things like, oh, people ask me, oh, Dr. Mims, how come all of a sudden, autism is everywhere? How many children truly live with autism? And on the global context, the World Health Organization estimates that for every 100 children, there's one child on the autism spectrum. And on the grand scale of things, that's a lot. And aside from that, we have many others who live with other conditions like ADHD, dyslexia, sensory processing disorders, and other neurodevelopmental differences. And another thing I want us to remember is that it is commoner in boys. And that's to say that we see, so when we talk about epidemiology, we're looking at how often this occurs and what gender is commoner in. It's commoner in boys. There's no, not to say unfortunate, because in either gender, it's still, unfortunate to say that this is more common in a child. And that's the global context of autism. Next slide. So what are the early signs? I get that a lot as well. Early signs. How do I know? Is this something we can detect in utero when the baby is still in the belly during the antenatal? Unfortunately, no. The signs are usually seen when the baby is already out. So some of the signs can be seen quite early as 6 months, some as late, as 2 years. So some of the early signs we see is delayed speech, and this is the commonest complaint a parent will come with to the clinic. My child isn't speaking. She should be speaking by now. She's just having a few words. We have poor eye contact. You're talking to a little human, they're not looking you in the eye. That's another early sign. Limited response to name or no response at all. You call a child, they don't even acknowledge that, their name has been called, not by movement, not in sound to say yes or na'am, like we'll say in Hausa, they don't even acknowledge that they've been called. Repetitive behaviors, like I've said, they're flapping their hands, they're spinning, they keep repeating the certain word, just something that it keeps going on and on, sometimes for hours. Some children who are autistic can spin for 2 hours. You spin for a few seconds and you get dizzy. Or they can jump. And I know I have a friend whose son is autistic, and she just got a mini trampoline, and he could jump for 2 hours on that trampoline, just expending energy he needs to exert, And then they have sensory sensitivities. So we're talking all the senses you can think of: sight, smell, hearing, touch, taste. So sometimes the lights are too bright or not bright enough, or the sound that to you might sound like everyday sounds quite intense, and they have to ear them off and block their ears. And sometimes in terms of touch, they don't want you to hug them. They don't like certain textures, like they wear only cotton, anything lacy or woolly, they wouldn't wear it. Or in terms of taste, some children, if it is this way, they're not going to eat it. Some of them have to smell their food before they eat it, or the color doesn't appeal to them, they wouldn't eat it. Or the texture of the food, if it's crunchy, it's a no-brainer, they won't have it. Some people prefer the crunchy ones, would have Holy Golden one without water, or Indomie that is raw, or just Pringles, would never want it anything that is watery or mashed. So these are some of the signs you would see in a child, and this is just but to name a few. Next slide. So if you're looking at things like as early as, like I said, as early as 6 months, you could have a child with no social smile. So when babies are born, sometimes you see them smiling when they're sleeping. We call those dreamy smiles, because it's not in response to any type of stimulus. But by the time they're 6 months, we expect that a child will be able to respond to an external stimulus like tickling or cooing or just smiling at them. Poor eye contact, unusual attachment to a particular toy or object, not sharing items or showing interest, no babbling or pointing. Something as simple as pointing is a very important milestone. If a child is not able to point by 12 months, it's a red flag. Okay. We have other things like no 2-word phrases by 24 months, or this is very important as well, loss of skills at any given time. So we're talking about repression. And that's the scary aspect of it, even for me as a medical doctor who is also a mom. The knowledge that a child can develop normally until they're about 24 months roughly, and then they begin to regress was one of the scariest things for me as a parent. And because I had the knowledge. So you can have a child who is born, attains all their gross milestones. So gross milestones means sitting, crawling, and all of that. They begin to have words, they're saying mama, dada, and all of a sudden, I met a woman one time in the UK and she told me that her son, she saw had a little baby, and then we started having a conversation, and she told me about her son who has high functioning autism. We do try not to use that anymore. And she said he had words, but literally after he blew his candles on his birthday cake on his second birthday, she regressed. He became non-verbal until she sought intervention and he started speaking. At the time, she said he was married, but very scared to have children because he was worried about passing, the gene to his child. So you can have a child who has developed normally and then regress, and that's the importance of just wellness checks, because in the places like the UK or the US, they have a schedule for wellness visits, which I've tried to replicate at my clinic, where at 18 months, a child gets, regardless of the background history, gets a screening for autism, and at 24 months as well. So that's the importance of sometimes just taking your child when he's well, just to see if everything checks out. I know we don't have that kind of habit in Nigeria, but it's something you have to imbibe. Next slide. Now, let me just briefly say what autism is not. I believe on another speaker will talk about maybe the myths surrounding autism. Autism is not caused by vaccines. I'm saying that as a medical doctor, as a scientist. A lot of research has shown that that is not the cause of autism. It's not caused by poor parenting. In the past, there were so many theories, even calling mothers refrigerator moms, because the theory was that moms were being so cold and that's why their children had autism. And it is definitely not a curse or a spiritual issue. As you come to learn, people say, in the north where I come from, that's very common. They say spiritual is a curse, but it's not. It is neither of them. It's okay to pray and seek, divine intervention, but just know that autism is not a curse. Next slide. Now, this is the beef of my discussion today. It's awareness. So we hear a lot about awareness, whether it's about sickle cell or breast cancer, and then nowadays we're hearing a lot about autism and other neurodevelopmental, conditions. But like we're here to talk about today, awareness is not enough. It's not enough to say, oh, I'm aware there's something, like autism. We have to move beyond all of that, and get to understanding, and then acceptance, and then interventions, and then, ultimately action. And that is what we're going to discuss today. Now, the problem with awareness is that it's everywhere. There's awareness everywhere. We're seeing posters, we're seeing posts on social media, there are campaigns, there are hashtags. But despite all of this, many children are still excluded from schools. Families are still struggling. Children are still misunderstood at home. And most of these families are not even supported in the communities where they exist. So the question is, if we are aware, we're more aware now, why are things not changing? Why are things remaining the same? We're still having the same problem. Like I was telling a mom today, I was like, even in my extended family, I remember one of my aunties was saying something about, and so why doesn't he? I was talking about a patient who had come into our dental clinic, and we're trying to see if we could do like the scaling and polishing, and without anesthesia, because he's autistic, and we realized that we couldn't. We needed to use anesthesia. And she was saying, so why was his dentition so bad? I said, oh, he doesn't like to brush. So she said, oh, why? I said, because he has sensory issues. Yeah, that why won't the one? So I was like, my job isn't done. If somebody in my family is still not understanding that a child who is autistic could have these issues, and we now have to make accommodations for that, I knew that my work wasn't done. So you can imagine, for somebody like me who is always talking autism, I still have people around me who still are not aware why this exists, or why they exhibit certain, signs and symptoms. And like I said, people will always ask me, the parents, Dr. Mims, why do we have more autism now? It's not being overdiagnosed. And we look at things like how they discover new stars and new, in terms of astrology, the more modern telescopes are being made, you're identifying a new star, a new body. So we are using a different lens. Now that we're looking at a child who is, we're learning more about autism. We're now seeing more of the cases because we're now using a different lens to look at children as a whole. And that's why I think it's becoming more, not because there's something in the water or in the food they're eating now. Well, that, in terms of, chemicals and exposure to other things is another aspect of it. But autism has always been there. I'm fast beginning to realize some older people in our families who have passed were autistic. Older people in our lives, were autistic. When you begin to understand the signs and symptoms of autism, you begin to see certain traits, even in yourself, that might point to you being maybe mildly autistic. So it's not like it's becoming more now, we're just becoming more aware. Next slide. Now, is in terms of talking about awareness versus understanding. So, like I said, it's not enough to be aware. Awareness is, yes, I've heard about it. I know what autism is. So I joined one seminar and I logged off. And no, the doctor said autism has to do with the brain. So yes, you're aware, but you understand it. So understanding is, I know what it means and how it affects the child. That is understanding. It's understanding that, or when you begin to see behavior as communication. And that shift alone, changes everything. For example, I say, this child has autism. I'm aware. But understanding is saying this child processes the world differently and I need to adjust how I interact with this child. That is understanding. Next slide. Now, why does understanding really matter? When you're aware, you know that this child is the way they are. But understanding will reduce your judgment. When we truly understand, we stop labeling the children as stubborn, difficult, rude, poorly raised. I see the judgment even at the clinic. Some of the children have come down from therapy, they're waiting to be picked up, and some other parents have come for just regular illnesses, fever, cough. And when some of these patients are having some of, the behaviors, exhibiting some of the behaviors, perhaps just, rocking back and forth, or not wanting to leave the play area because, they don't like transitions. And then we're having to be a bit, trying to calm them. Some of them might piggyback them. And I see some of the parents looking like, hi, Dr. Mims back in this big boy, or this child. I know a parent that saying, this kind, by the time I knock this child, So these are the things that even it hurts for me to see it, talk less of a parent who is raising that child with just little support. So if those parents understand what autism truly is, there'll be less judgment, there'll be support. They'll be the ones to say, okay, trying to distract the child or trying to, empathize with the parent. And it changes responses. Because like I said, we begin to see that behavior as communication. That child is rocking back and forth. Maybe he needs to pee or the room is too loud. Other children are making too much noise. And it builds empathy. It builds empathy. And like I said, that shift alone completely changes the outcome for that child and their families. Next slide. So we've talked about awareness, we've talked about understanding, and then we're talking about acceptance. But is it really enough to just accept and say, okay, yes, this is autism. I understand how your brain works. I've accepted you. You can exist in my own world. But is it really enough to say you can exist? And that's why we have to move to inclusion. Because inclusion says you belong here and you can participate. So let me put it to you this way. It's like a school, and I'm going to talk about schools a lot because that's what I face. It's like a school saying, the parent comes and says, oh, my child doesn't talk. He has problem with changing routines. He's not potty trained. And they say, oh, no, we can take him because this school is looking for students, right? And they take this child. But then again, this child is in the school, but then they're not involved in any of the activities. You go to a class, you see a little girl in a corner on her own. She loves puzzles, but she doesn't like to transition from puzzles to any other task in class. And the teacher would rather leave her be because they feel if they tell her to transition, she's going to throw a tantrum. And they say, oh, she's so well behaved, just give her puzzles and she's fine. While the other kids are learning and moving on, she is left behind. And when the parent comes pick her from school, say, oh, A was fine, she was well behaved, she finished all her food. Meanwhile, she was left the whole day doing puzzles, while other kids moved on to learning about countries in the world, learning about continents, learning about how matter evolves. She was left in a corner doing puzzles. That is not inclusion. That is just presence. So inclusion says you are valued here. We will make space for you to thrive. Next slide. So what does inclusion really look like? Like I said, it's not just a seat at the table or placement in a school or giving a child a chair and a desk to say, oh, you can sit here. Inclusion has to do with adapted learning. So I've had a patient who, not autistic, very bright girl, creative, very good with her hands, can paint. But she said to me, she was like, she doesn't like learning in school because she's a visual learner. That's what I came to realize. She's like, everything is so theoretical. They don't use pictures or images. So for her, learning isn't fun and she's not really learning because there are no images. She's a visual learner. So you have to adapt to the environment. And I think we need to move beyond our traditional settings, like where everybody has to learn at the same pace. They have to learn in the same mode, to adapted learning. And so it's the same thing we have to do for our autistic children. So we're talking flexible environments. There are certain children that have hyperactivity. So before interventions have gone far, they're not able to sit for long. So if you're going to give 10 problems for children to solve in the class, for that particular child, you're going to give them time to solve 2, time out. So structured movement breaks. They move around the class or do something they like, they get reinforcement, move back, do 2 more. The only difference is it might take them longer to complete that task, but they're going to complete it anyway because you've introduced things that will help them to cope. So we're talking equal opportunities. I had to do like a report for a child who was going to write his like professional exams in the UK body and suggest certain things that can be put in place. He's 13 years old, autistic, to help him write the exam and thrive and see his full potential. So we're talking about noise cancelling headphones. We're talking about structured breaks for him. We're talking about timing and pacing him. So this is giving him, so we're talking equity here, so that he has the same platform as other children. Because some of them, you see a child who, and most of these children, as you come to learn when the other speakers speak, is that their IQ is actually very high. But you see that they're not doing well in school, not because they don't know it, but because they're not learning in their own style. So a child who has a high IQ, is hyperactive, does 2 tasks, gets very, uncomfortable, he wants to move around. He ends up not finishing the task and pencils up. He doesn't do well, not because he doesn't know it, but because he didn't complete it. And that has to do with his hyperactivity and active participation. I know schools are very inclusive. Some of my patients, I go to their schools maybe during graduation and I cry when I see them on stage. You see some of them with their babe, they're drooling, but they're involved in the dance, in the drama. And it makes my heart smile because that is what true inclusion looks like. Allowing them to actively participate in all spheres of the school, regardless of their capabilities or their challenges. Next slide. So if we're looking at inclusion, then let's talk about the barriers to true inclusion, because inclusion has to be true, not just, at lip service. First and foremost is stigma. This is one of the biggest barriers, and it's not the children who are the barriers. The barrier is the systems around them. Stigma is a huge barrier in everything. Is it HIV? Even cancer. We have medics who would hide cancer until it's in the end stages before they come to seek for help. And they know the implication, but they're running away from stigma. So stigma is a huge barrier to almost everything, and to autism and inclusion. Lack of knowledge. Lack of knowledge is a barrier to inclusion because for people like, we've talked about awareness and understanding. So if you're not even aware, if you lack the knowledge, how do you include these children? So we're talking about, like, for example, our gracious hosts, the Jewel Leading Lights. They have trained professionals. They know what it means to include a child because they know what to do. So if you're a school that has no knowledge about what inclusion really means or what interventions do for a child or what an autistic child is really about, you're not going to be inclusive because you don't even know how to adjust the environment to suit them. You don't know what their challenges are. So how do you help them? You don't know what their strengths can be. How do you magnify it? So knowledge is very, very important. Limited resources. I see a lot of schools that have reached out to me that want to be inclusive. But how many professionals do we even have in Abuja? I remember as far back as 2020 actually. Back then, before that, I was doing online consultations and I would have parents reach out to me virtually on a platform and say, oh, my child isn't speaking. And just a screening tool I would use, I realized this child has high risk for autism. And then advise that, okay, they get screened. And then the question is, Dr. Mims, what next? How do we get the intervention? And I remember then I would call all over Abuja trying to find, is there a speech therapist? Is there an OT? Is there an ABA therapist? And there were very few, very few. Lagos was doing far better than us. So now in Abuja, we're doing better, but it's still limited. For occupational therapy, if you check the whole of Abuja, I know them, they're very few. Limited resources in the sense that catering for children who are autistic, you need resources. So you have to be willing to even invest in them because the schools want to do it because they want to have more children. They want to say they're inclusive. Are you ready to invest and be committed and be intentional about working with children who are autistic? Then we have very rigid systems. Very rigid systems. You know, the structures that prevent inclusion from truly happening. And it's because some of the schools have refused to move away from what they know traditionally to what needs to be done. So that again is another barrier to inclusion. Next slide. I've been warned that my time is almost up. So what is our reality here in Nigeria? Our reality, first and foremost, is, especially in our environment, is many children are misunderstood. They are labeled as stubborn. Like I said, they're sent out of classrooms. They're not even given a chance. And this delays diagnosis because we don't even identify that there's a problem. And then we're talking parent burnout because parents are left to navigate this alone, emotionally, financially. And that is a heavy burden. Then school rejection. I want to say this here today. I genuinely appreciate the schools that tell the parents upfront that we can't, we don't have the facilities to work with your child. I think you should take him somewhere. But it is in the tone and how that message is passed. I've had a mom come into the clinic crying because of how the school rejected. Rejection is a strong word. Rejected her child. Some of the schools are disingenuous. They'll tell you, oh, we do it, but they're not inclusive. I respect, like I said, the ones that refer them, but do it kindly, do it with grace, do it with empathy. Please. Next slide. This image I found on the internet and it stayed with me. You can see that there are other children maybe on the assembly ground, carrying on with their day's activity. And these children, merely looking at the noise cancelling headphones, you know that they're being excluded. They're autistic, sorry. And you can see that they're standing outside the gate. And this really, really stayed with me because it struck a chord and it showed the reality of what we're facing here today. Next slide. So what is the cost of inaction? Being aware, understanding, and not doing anything about it. We lose potential. Today we know of the Albert Einsteins, the Bill Gates, the Elon Musks, the Gretas of the world who have genuinely contributed to science, technology in the field of music or math. All these people on the spectrum, imagine if they were not identified and their strengths were not harnessed, we would have lost a lot of potential. Then there will be increased dependency because when we fail to include, we don't just affect the child, we affect families, we affect communities and the society as a whole. And we lose the potential for that child to contribute meaningfully to the society. So the societal loss, there's emotional impact on the families. That is the cost of inaction. Next slide. So when we're talking about from awareness to action, this is what the journey looks like. Like I said, awareness, understanding, acceptance, inclusion, and the last but the strongest point is action. Action is the most important. Next slide. So what does true inclusion demand? Inclusion does not happen by accident. It takes intentional effort. It requires system-level changes. It requires proper training of caregivers, teachers, healthcare providers, because the truth is, even as medics in medical school, nobody taught us about autism. They glossed over it. Okay? It's something you have to learn. You have to invest in training and in coursework and write the exams. Training and education, and also the parents need to be carried along. They need to learn all these things because intervention happens across all board, class, where therapy happens, and even at home. Next slide. The role of schools. That's what I want to talk about next. Next slide. Okay, so we need to prioritize early identification of the signs like we've talked about, and I believe another speaker will talk about the early signs, early identification, early diagnosis, seeking early intervention. Now the role of schools, teacher training, and again I want to commend Joel's leading lights. I've heard a lot of glowing reviews, and the truth is I don't take reviews from the schools or the people in charge of the schools. I take it from the parents. So kudos to them. You have to train the teachers, not just have glorified nannies as shadows or send teachers. They have to be trained in different principles of AB, of speech therapy, OT. We have to imbibe flexible teaching methods, supportive environments for these children to learn and thrive. Next slide. We have to talk about role of the parents, because parents have to be, I always say the parent is the first advocate for the child. They have to advocate for their children. They have to support each other, speak up, and demand better systems for their children. Awareness, awareness, awareness that leads to action. Next slide. So small actions, big impact, right? Inclusion doesn't always start big. It starts small, just from creating awareness, doing seminars like this. Sometimes it's everyday actions, being patient, adjusting expectations, and creating safe space for children to just be themselves and celebrate these differences that we see between, children, and saying this child is different and that's okay. This is how this child interacts and that's okay. Next slide. Second to the next slide. No. Now, this is a call to action for all of us that are here today. I challenge each of us today to see the child, not just the behavior. So I want you to choose inclusion today. So awareness is where we start, but action is where change really happens. If we truly want inclusion, then we must be willing to do the work. Awareness is where we start. Action is where children's lives actually change. And that is the goal. Thank you.
Oh my goodness. Thank you so much, ma'am. That was insightful. Everybody, please put your hands together for Dr. Zainab. I mean, if you got anything from there, I've been taking notes and I'm like, this is amazing. Awareness is where we start. Inclusion. Like, I think one of the things that she said was, it's not just enough to have just teachers that shadow these children. We need teachers that are part of the system, teachers that understand OT, PT, ABA therapy. Like, imagine if that is what our schools are. Thank you so much, ma'am. Thank you so much. Thank you so, so much. Please, you want to be around for the panel sessions because I can see your questions and you are going to have an opportunity to ask Dr. Zainab first all your questions. All right. Thank you again. I appreciate your coming and thank you for the insightful wisdom you shared with us. All right. So as we continue now, we're going to shift our focus to awareness and action as a critical role for families in driving that inclusiveness that we are talking about. All right. Our next session is titled From Awareness to Advocacy, Families and as Champions of Inclusion. I love that, families as champions of inclusion. This session will highlight how parents and families can move from being observers to becoming active advocates for their children and for an inclusive system. Please join me and welcome our second speaker, Dr. Oluwakemi Adediran. Can you all put your virtual
Olukemi Adediran is an author, university lecturer, and speaker whose work centers on faith, resilience, and the power of hope in the face of life's unexpected journeys. She lectures in horticulture and is passionate about mentoring young adults and nurturing purpose in the next generation. She served for many years in children's ministry, where her experiences deepened her conviction in God's care for children and the unseen workings of His angels. Her writing and speaking are drawn from her personal journey as a mother raising a child with special needs, sharing lessons of faith, perseverance, and the quiet miracles that unfold along the way. She is the author of Meet Zuriel, a heartfelt story that has encouraged parents and families to embrace hope, trust God's timing, and discover beauty in journeys they never expected to walk. Let's welcome Dr. Oluwakemi Adediran.
Welcome, ma'am. Hello, Dr. Oluwakemi, are you here? All right, let's just hold on while she joins in. Probably she's having network issues.
Everyone, Joy Lights, right?
Joy's leading lights.
Joy's leading lights. Good afternoon, everyone. I really want to thank God for the life of my grandson. Joining this school was a big blessing to us as grandparents, and I believe also to his own parents. It was a blessing, and there has been a tremendous, wonderful improvement in his life since he came here. He has improved so well in all his activities, academically, behavioral, in fact, in everything apart from the speech aspect, which I believe God that he will improve and he will begin to speak in no distant time. I want to say thank you to the teachers, to all that have made this possible. And may God Almighty continue to bless you and increase you all in your wisdom, in your ideas, to be able to train up these children the way parents will be fulfilled. In the mighty name of Jesus. Thank you. Thank you, Mr. Press. Thank you, Mr. Solomon. Thank you, Auntie. I can't remember the name now. Thank you, everybody. God bless you.
Thank you so much, ma'am.
Okay, my name is Sauni and I'm Mufe's mom. Mufe is in grade 4. We've been here for like 5 years. Okay, my name is Sauni and I'm Mufe's mom. Mufe is in grade 4. We've been here for like 5 years. So far, the journey has been challenging, actually, and as well good. We can see a lot of improvements in Mufe. First off, we are at peace that Mufe is here because we know he's in a safe hands. There was a time we wanted to change school and then went around looking for school. To be honest, we didn't get any place that we're so comfortable with that we can say Mufe can be there and then we're at peace at work. But here is different. To be honest, we can see the commitment that the teachers put in to educate the children, and they've taken Mufe as their own child, and that has given us joy and peace. His speech has really improved. You can communicate. We can literally communicate with Mufe, which wasn't like that before. Now you can tell Mufe, what do you want? We can communicate, and then he will tell us. Unlike before, that it wasn't like that. And to some extent, he's interacting with his sibling. He knows his numbers very well. That one is good at it. A lot has been done, and we really appreciate. We appreciate the educators, and then we say God will continue to bless you. Amen.
All right, so it looks like we'll be going on to our next speaker. Fortunately and unfortunately, but I want you guys to fasten your seatbelt. All right. Now I want to introduce Dr. I want to introduce our next speaker. As we proceed now to take a deeper look and a more reflective look into how to perceive and engage with individuals who have different abilities. All right. Our next session will be titled Beyond Labels, using therapeutic engagement to appreciate individual differences. This session will help us move away from limiting labels towards meaningful engagement that truly supports each child's uniqueness. It is my great pleasure to introduce our third speaker, Dr. Omolola Okeowo. Please put your virtual hands together for Dr. Omolola Okeowo as she joins us on this.
Dr. Lola Okiowo is a trained medical doctor, autism professional, behavior analyst, self-mastery coach, and tech enthusiast. She is the visionary founder of Autism Renewed, an online consulting practice dedicated to coaching parents on how to help their children overcome speech delay and other developmental challenges. She is also the host of the Autism Renewed Conference, an annual gathering designed to educate and empower parents and the public with actionable strategies to support children with developmental delays. As a self-mastery coach, she leads individuals through transformational journeys, helping them understand the seasons of life, break limiting beliefs, unlock their full potential, and embrace limitless possibilities. In addition, Dr. Lola's passion for technology has led her to teach professionals how to transition into the tech industry, access remote job opportunities, and thrive by leveraging their existing skills and experiences. Dr. Lola is also a prolific author of several impactful books and a sought-after speaker, having been privileged to speak on numerous platforms, webinars, and conferences across the globe. Her lifelong mission is to live a life of fulfillment, not just survival, and to help others do the same. Let's welcome Dr. Lola Okiowo.
Welcome, ma'am.
Welcome, ma'am.
It is so amazing to have you here today.
Thank you. It's my pleasure to be here. I'm so honored to be here. I want to appreciate the management of Just Leading Lives, Mrs. Tony Obo and her team. Thank you so much for having me.
Awesome. Welcome. Now over to you. Please go ahead.
Okay, let's go. It's showtime. Do you want me to control my slides on my end? I can share from my end if you want me to. All right, good morning, afternoon, evening, whatever time it is. Again, I don't take it for granted. Thank you to Just Leading Lights for championing this cause. So today I'm going to be talking about Beyond Labels, understanding therapeutic engagement to appreciate individual differences. So as I speak, if you have any questions, please just wait till the end, and I hope I'll be able to take questions because I have a lot to say. But let's get right onto it. So I'm going to share a real life story, and this is a true life story. One of the clients I've been privileged to work with, like it was said in my profile, I work with parents of children who have developmental delay and autism to teach them how to help their children navigate and to thrive. I believe that an empowered and informed parent becomes knowledgeable enough to become a parenting advantage to help their children navigate and thrive. In my journey to see children who are really transforming, one thing I've found globally is always a parent or a caregiver. Usually most times parents are the caregivers, but in few cases we have times that the parents are not the primary caregiver for different reasons, death or sickness or things like that. But the primary caregiver taking the champion seat really is what really transforms, because as a parent or a caregiver, you make the critical decisions for the child. School, therapists, professionals. The parent taking the center is one of the most important things from my own experience. And I say something that no matter how good an intervention or a therapy a strategy is, if the parent or the caregivers are not involved, I always say something that any therapy that does not carry the parent along or does not involve the parent, it's not an effective therapy. Okay, let's go. So a true life story. So I had a parent that I worked with. She had a report. The child was non-verbal, not reading, hyperactive, not following instruction, significant, classroom challenges, school challenges. Mother was overwhelmed. Parents were struggling. Most times I still remember that day till today. Their expectations were like, they weren't expecting much. But one thing that the report did not say was this about the child: how he notices patterns that nobody notices, how he can build things, how creative the child was, how he had what we call a photographic memory, like he remembers things a lot, how funny he could be, how determined. Sometimes determination was almost like being stubborn sometimes, or looked like he was fixated on things, and how creative, in an extraordinary way that you get to see later when I talk about him. And he was always capable. He just needed to be understood differently. To tell you about this wonderful client of mine today, he's fully conversational. He reads independently, follows instructions. He was in a special ed class in the inclusive school. In fact, the school had to tell the parent that we don't really think he needs this extra support anymore. Now he has joint attention. His executive functioning skills are actually, way better. Now he's independent. He can do chores. He can dress himself. He's even beginning to cook, little things here and there. He's so independent. In fact, the creative skills, he likes to put things together now, things that looked like he was being stubborn or disruptive. Now that we're able to channel it in the right way, they realize I actually liked project-based learning. And when you talk about project-based learning, these are children who like to fiddle things, put your wires together, try to tear your paper and your box. And if you're not careful, they will tear your valuable, your valuable things, and trying to just create something. So he's like a little scientist now. He put wires together, lights one thing here and one thing there. He designs things and things like that. While this may not be like a typical picture for every child, but I say something that every child deserves a chance. And as a professional, one thing I've learned is I would never say what a child cannot achieve. I can tell you according to what I know or according to what the studies have shown, but I tell people that nobody is God. So nobody can play God in the life of a child. As a professional, the best of professionals are still men. And whether you like it or not, science is even progressing. There are things that we didn't have answers to years ago, that in science, today we have answers. So I believe that every child deserves a chance, to get the best opportunity, the best support. You can't put a cap to how much a child will be able to achieve. Whether we talk about whatever level, whatever severity, I tell you, nobody is God. And I tell people that I'm not God. I can never say never. I would always say according to what I know, because what I know has a cap, but science is progressive. And of course, God has endless possibilities. So that's why, even though I would say this may not be the present reality of so many people, but trust me on this child. Even when I think about the child, sometimes I'm like, one of those consultations that it was not like, the way people say that maybe it just looked like a normal consultation. But every time I hear the amazing transformation, and our upcoming conference later this month, I'm hoping to have the parents at the conference, because I always like to share during our conference stories of hope, where I bring a parent who has walked a journey. It doesn't mean that their child is now all perfect. Their children are still on a journey, but they are a lot of parents are where they used to be. And to give other parents hope and to know that, there are endless possibilities, just give your child a chance. So what changed? So we moved from what is the diagnosis? What is the label? What are the limitations to what's happening to this child? What is getting in the way of his ability to do certain things? How does this child learn? Those are the questions we need to begin to focus on. And what was the outcome? Like I said, fully conversational, strong executive functioning skills and all that. We were able to discover, his endless creative abilities, and he's still on a journey, So the key insight is the abilities were always there. But they only became visible when we stopped focusing on the label and we started understanding the child. The label told us what was wrong. The diagnosis told us what was happening. But therapeutic engagement showed us what was possible. So at Autism, I always say something that you cannot help a child from the point of a diagnosis. You help a child from the point of understanding. And what I mean by that is a diagnosis can just be a label, because you can have 3 children have the same diagnosis. In fact, have the same symptoms or manifestations. 3 children may have autism diagnosis, whether the same level, whether the 3 of them are non-verbal, or I like to say pre-verbal. I prefer to say pre-verbal because sometimes you think a child will never talk. I've seen someone talk at 16, 21. I've even heard a 27-year-old, a child speak for the first time at 27. So like I said, I can't say never. Okay. So I believe that just looking at a diagnosis and just equating that this is what you're going to do, you can't really do that. What you need to do is to understand what is going on with the child. So you must be able to individualize the child and find out what is going on and the areas in which we can support the child, and we can begin to put therapeutic strategies in place. So that's why I always say you can't help a child from the point of diagnosis. You're just bringing the diagnosis forward and now saying that even speech delay, you can't just say speech delay is not speech delay. There are different things that could be going on, as we'll see as I proceed. All right. So today we're going to go beyond labels. So I'm here to help you see children differently, because when you see them differently, everything begins to change. So on today's journey, we're going to talk about why labels on their own they may be holding children back, what individual differences in autism can look like, what therapeutic engagement really is and where it happens, and how we can use this engagement to appreciate individual differences as strength, and what this actually looks like practically, and what you can begin to do from today. So I say that a diagnosis should open a door, not close it. Meaning that the fact that a child has the diagnosis shouldn't just put a label and like a cap on what a child can do. Because sometimes I will hear people say, a child is not reading, and you say the child is not reading because the child has autism. That's incorrect. That's not exactly correct. Okay? 3 children could have autism. 3 of them may be having challenges reading, but the reasons why may be different. Of course, there might be things that are peculiar that we often see in children with autism that could make it challenging for some of them to read. But you don't equate a diagnosis to a reason for a challenge and now cap that the child cannot do it. All right? The purpose of a label is to provide a framework for us to understand, for understanding, like I said. When you have a label or a diagnosis, it helps us to understand maybe the scope of the possible challenges that could be taking place, possible hindrances that could be taking place. So it will guide us to know how to, assess and where to begin to put interventions and therapeutic strategies. All right. So it's supposed to open access to support. It's supposed to give families a name for what they are experiencing. All right. So the problem with the label is it can become a ceiling instead of a starting point. So labels like maybe autism spectrum disorder level 1, level 2, high functioning, low functioning, non-verbal, all those things, they're supposed to be a guide, or like I said, a door to understand, to get a framework of a better understanding, so that when you hear level 3, it's not to put a cap and say because it's level 3 it's so severe nothing can be done. It helps you to understand maybe the level of severity we are currently dealing with. Or you say level 1, it doesn't mean that the child doesn't need any support, so it's not supposed to be a ceiling. All right. Okay. Because it doesn't describe a person, it doesn't explain why a child is struggling, and it does not tell us how to help necessarily until we can really drill down and individualize the child and find out what is going on. Okay. So sometimes when we just stick to labels, we're talking about going beyond labels. So when we stick to labels or just a diagnosis, it can limit expectations. So you can have teachers, lowering their standards, what they believe a child can achieve. So you hear a child has autism, the child is not reading. Some, like, as previous speaker was talking about inclusion, some people will just think, oh, child can't read because the child has autism, instead of thinking about what are the struggles What are the possible challenges? And are there strategies you can put in place to support this child? All right. So when we just think from the point of the labels, it can just limit expectations without even giving the child a chance. Parents can begin to grieve possibilities and assume that, case closed, nothing can be done. I can remember these parents when they came to me. I had to do a lot of encouragement because it was like, they were almost giving up, Clinicians sometimes can design an intervention for a diagnosis and not the child. And I've talked about you can't help a child just from the point of diagnosis, because diagnosis does not equate a specific strategy for every child. Then the child, if you're not careful, the child can internalize the ceiling that is placed on them and begin to take their identity from that label instead of, seeing that, they can actually, stretch themselves, I remember a story of a mom who she was sharing about her child. Her son was pre-verbal. When he was younger, he wasn't speaking. Now he's older. I think he's in uni or something. She now said she was asking him one day that those days that you weren't speaking, what was going through your mind? Like she was trying to get into his head, like what was going through your mind and all that. And the boy said something that was very profound. He said, one thing that helped him was that he saw that his mom believed in him. He told him, I saw that you believed in me. You believed I could do a lot of things. And, you gave me a possibility mindset. And he said, because of that, I stretched myself. I was trying to rise up to that expectation and that belief that you believed I could do a lot of things. So I stretched myself to rise up to that expectation. And that never left me, because sometimes you think some children, they are not speaking. A lot of them, they actually can understand what you're saying, because I've seen people who are adults are now speaking. They're referencing things that people said years ago. So that's why it's very important, because, the things you say, the things you portray, it can, make the children internalize either positive things or negative things. So it's very, very important that you are intentional about how, we think about labels and possibilities for these children. So the ceiling effect just means that a label can shape expectations, that can make adults stop looking for potentials, because the label has already decided what is possible. That's what the ceiling effect talks about. All right. That it looks like the child is no longer seen. It's just the diagnosis you're seeing. And you're just seeing impossibilities, rather than say, okay, let's give this child a chance. Let's put the best strategies and best support that we can and give the child a chance. All right. So research tells us that when parents and practitioners are deliberately asked to work on strengths, such as, striking memory, some children have mathematical abilities. It's just that sometimes these abilities may not show in the typical way, because you're not teaching the way they learn. Do you understand? Some children have musical ability. Some children have very arithmetic ability. Some children have visual spatial perception. Some children are very artistic. Like I saw one documentary of a boy. He was on a plane. I think it was in the US. They went around, I think, New York City on the plane. You know how they do this tour, the city tour or something like that. And when he came back, he sat down and was able to draw like I don't know whether the whole, I don't know what part, like a whole section from he could recall and drew it exactly. That's the kind of photographic brain some of those children are. Very artistic, very creative. You understand? They notice the details that others don't notice, even though sometimes that could manifest in being fixated on certain objects or certain things. But if those kind of children begin to get intervention and you redirect that ability, you begin to see it in things like these details that you don't notice, and be able to interpret details like that. All right. So the label focuses the eye downwards. That means all the negative things that they can do. While therapeutic engagement will turn the eyes or your attention towards possibility. So a diagnosis is not the enemy, really. It's the starting point. The problem is when it becomes the end point. And I also I always like to say to even religious people, those of us that are religious, we like to pray and believe God to help our children achieve certain abilities. The truth is that even when you say that you're praying or you're standing in faith always has a target. So that's why I tell parents. Some parents are scared of going for an assessment because of a possible diagnosis. Say, God forbid, my enemy. I said, no. The diagnosis is not an enemy of your faith, it's a target of your faith. So you can't pray. You can't say you're standing in faith without having a target. Faith has a target. Prayer has a target. So you're not just praying what are you targeting? Do you understand? So having a diagnosis and understanding the areas that your child is having a challenge gives you a target, something to target your faith as. It gives you something, your prayer point is target. So if you're praying without a target, that is a fear-based prayer. That is throwing missiles anywhere and not targeting anything. If your child is having challenges understanding something, you want to pray. You can pray specifically. If your child is not speaking and you desire your child to speak, you can pray specifically. There are even scriptures that can target those things. So you're specific. So even when you're doing interventions, you pray. Because like I told you, the best of therapists and doctors are still men. Right? So it's a part of directing you to the right professional. Like it's my clients. One of the things that really helped the boy on his journey was also ability. They changed the school because they realized that the school that he was in was not the right environment and they did not have the right equipping, and it was not a school that partnered very well with the families, and that's why I love what Joe's Leading Light is doing. They school that they include parents that partner effectively with families, you understand, because that's one of the things that can really help a child, because when a child leaves school, a child spends a lot of time at home with the caregivers and with the parents, and those are opportunities to reinforce a lot of things. No matter how much a therapist come, do 1 hour, whether you do 1 hour a day, I wouldn't tell people 1 hour a week, 1 hour a day. Really, in the real sense of it, is not really enough. But when parents are able to partner effectively with the school, with the therapist, all those strategies are able to transfer it for reinforcement, for mastery, because you know that the concept of therapy is a concept of practice. So it's not that a child goes to a therapy room or even in school that the teacher teaches now, you are learning in isolation. No. Why are you learning anything? It's so that you can conceptualize it. You can transfer that knowledge to everyday life and those skills being built to everyday life so that a child can gain mastery. And there's something called generalization. So a child has not fully learned something if he cannot generalize the skills in different settings. So, but before generalization can take place, mastery has to take place, right? And before mastery can take place, you need different opportunities of exposure. That's where the parents and the family come in. So no matter how much the teachers will do in school, how much the therapists will do, the parents and the families must be able to partner with them such that they are able to, understand what they are doing. That's why you have an IEP, individualized educational plan. So an IEP is not even just academics. I'm sure we know that IEP has to do with the whole child. So even some strategies that the teachers, the school, the therapists are giving are strategies that parents can use at home. So whatever they are teaching is beyond academics. Academics is just part of it. They can transfer it to everyday life. The parent is with the child when you go to the mall, when you go to visit people, when you go to the church or the mosque or whatever. You are with the child in different settings. You can practice those things. All those interactions at home, day-to-day life or different things are opportunities of practice. So those several opportunities of practice, then the child will be able to consolidate, mastery will take place, then they're able to generalize. And when you have challenges, you can always go back to the teachers or even to the therapist, or you can explain, okay, well, we try to do this, we're experiencing this, or we're having this challenge at home. They can say, okay, no, try this, try. That's where they bring their expertise to partner with you. So that's why I said any intervention that disconnects the parent, it can't be effective, because a child can't just learn, okay, say cat, say dog. And I tell people that you say cat and dog to interact every day. Why is the child doing speech therapy? It's to be able to build language to interact in everyday life. So you must be able to take the therapy or intervention beyond the classroom, beyond the school. You're counting in class and all that. So the parents can transfer the same counting when you go to the shops. You can use fruits, vegetables, count different things to count in the kitchen, in the house, to count, So if you experience challenges, you go back to the teacher, this happened and that. The teachers use their expertise, be able to help you, to troubleshoot all those things. So that's why it's very important. All right. Like I said, the diagnosis is not the enemy. It's just the beginning. So like I said, you can't help a child from a point of diagnosis. So a diagnosis does not equal a full explanation. So when you think hyperactivity, so just saying a diagnosis of autism does not completely explain why the child is hyperactive. The child could be hyperactive due to different things. Could be sensory issues, could be Could be environmental. Hyperactivity could be external, things that are stimulating in the environment. So the children have, hypersensitivity to sound, to noise. Sometimes it could even be internal. Yes, internal, because you know that sorry, I don't want to be too medical, that the nervous system of the child, I said I have 7 more minutes. Okay. You didn't even really give me 30 minutes. Anyway, so the nervous system of the child can be, overstimulated, different things like that. Even some nutritional, causes can be there. That a child is not speaking. I talked about that. You can't just say it's because of there could be different reasons. A child is not reading. So you have 3 children that are not reading. One could be reading, maybe have challenges reading. It could be a functional eye disorder. There are things we call functional eye disorder, things like eye tracking or those convergence issues. Some children can have auditory hypersensitivity. Some children can even be like the style, the methodology I need to teach. Like most children with autism, for example, they have like an example here. They are right brain learners, and the methodologies of teaching with our right brain learners. Okay, and most of them are very creative, colorful, and things like that. So if you're using a left brain strategies to teach them, it could be a struggle. So you need to know why the child is not reading. So the right questions you always ask is that what are the obstacles in the way? So the obstacles could be external, could be internal, could be different things, even from genetics, could be diet, could be environmental. And are there skill gaps? Because sometimes some of these things can lead to skill gaps that we need to deliberately now build. Okay, does the teaching methodology, the environment, what strategies does this child need? All right, not just thinking about the diagnosis. So individual differences I've often seen in children with autism. Like you say, when you see one child with autism, you've seen a child with autism. Autism is not just one straight line. Like I say, it's a spectrum. So we have different different things that you can see. That's why we say no 2 children are the same. So individual differences that are often common. We could have communication differences. Some children can be fluent, some children have words, some children don't. Some children can speak, but when it comes to language, you're talking about pragmatic use of language, social use of language, or pragmatic use of language. That's what we're talking about. Use language in the right context, not just words. Or not that my child is singing, my child can, things like that. Also understand cues, body bound, what do you call it, language, like social use of words. Then some children have sensory processing, issues and different senses that we have, the taste, the touch. But we also have, apart from the 5 senses, actually there are 8 senses. We also have the vestibular, the proprioceptive, and interoception. So the vestibular and the proprioceptive is oftentimes you see most of them jumping and spinning because that they are like sensory seeking, trying to regulate their proprioception. The vestibular, the proprioception is you see some children that they don't walk straight, they kind of like run into things, and that's because they struggle to maintain themselves against gravity. Things like we talk about motor planning and other things. I don't really have time to go into those things here. The interoception is the internal milieu. That's why you see some of them have things like constipation. Some of them, they have they're picky eaters. Some of them, you say, your parents say, I never know when my child is full. Things like that has to do with the interoception and things like that. Then, of course, different cognitive differences. Of course, emotional and social engagement are different ways they engage their environment and present emotional engagement. Then executive functioning skills, that's the planning, organization, task initiation. That's why most of them struggle with transitions. They are doing one task to transition. Those are executive functioning, issues and all that. So you think of a child like a fingerprint, every child is very different. All right. So when we look at only the label, what we miss is that the child. So when we see a child who seems that the child is withdrawn, child is not responsive, what therapeutic engagement will help you to see is that their extraordinary pattern recognition, their visual memory, other things. The child is not absent. They're just processing the world in a different way. Things like a disruptive child. Oh, this child is so aggressive, is defiant, is difficult, out of control. Therapeutic engagement will show you sophisticated communication. The child may be telling you something, you understand. They may be telling you that they are overwhelmed, because every behavior is a communication. Every behavior, whether it's disruptive, is withdrawal, the child is speaking something. So what you need to do is to interpret the behavior. They'll be able to understand the intervention to put in place. So when a child that is just that seems to follow rule and seem to have no difficulties, it may be masking. That may be masking, all right? A child that is gifted but is difficult, exception in one area, we call them the 2E children, all right? You understand? Maybe a child, therapeutic engagement will show us a child whose abilities do not develop the same way at the same rate as other people. So they may be academically advanced, but they may be socially behind. I've seen clients like that. The child is academically advanced, socially, even sometimes cognitively. When you begin to drill down comprehension, the child may be behind in those areas. I'm trying to rush now. Okay, so when you appreciate these individual differences, the strength, you begin to see the strength on their inside. So you look at their memory, photographic memory. Some of them are very exceptional when it comes to mathematics, music, creativity. So what you do is that you build from strength onto weakness. So from label to their learning profile. So you move from the diagnosis. From what does the child have as a diagnosis? So how does this child learn? How do they process? How do they engage in their world? All right. So that framework will help you to understand what are the skill gaps, what are the challenges they have, what kind of learning profiles do they have, what kind of environment do they thrive in? All right. So you cannot fix what you have not identified. So before you put an intervention, identify the barrier, understand and match it to the strategy. Like I said, if a child doesn't learn the way you teach the way the child learns. That's one of my greatest skills. If a child doesn't learn the way you teach the way the child learns. This involves academic skills, everything. So a child struggling with writing, for example, you can start with teaching typing. Because the writing may be due to maybe the small muscles of the hands are weak. So while they are working with occupational therapists to build that, it could also be things like palmar graph research. So while the therapists are working on those interventions, don't wait. Begin to teach things like typing. A child that is strong in art and not strong in things like writing or comprehension, you can use art. Even parents that have neurotypical children, that they'll say that things like essay writing, comprehension, my child is struggling, but your child is good in art. So I tell them, get your child to interpret the question in a graphical form and draw it. Then the child can now take the art and interpret it in writing. So for a child that is strong in art, you can use that as a strength. That's a difference, as a strength. So you build from strength to weakness. A child who loves building things, use project-based learning. So that's why things like play-based learning, Montessori, all those play-based, project-based learning. The goal of learning is you understand the outcome. So how you get to the outcome doesn't matter. You can teach science, for example, respiration, using a textbook. You can teach with a documentary, how to breathe, watch a documentary. You can teach with flashcards. You can teach with drawing and things like that. So if a child loves to build, use that as a strength, project-based learning. So I talked about therapeutic engagement. It is an intentional relationship based on interaction, designed to understand and support the individual, not just manage the behavior. It's grounded in strong therapeutic alliance, built on trust, empathy, and genuinely non-judgmental stance towards the child's neurotype. I'm almost done. Just give me like 5 minutes, okay? So where therapeutic engagement happens, it's not just in the therapy room. We have the therapy room every day, like I talked about it. That's where the family comes in the kitchen, in the school classroom, in the car, the playground, when you go visit anywhere. It's not only for clinicians, parents, teachers, caregivers who are willing to pay attention differently. Every moment of intentional connection, it matters when you're having therapeutic engagement. I'll talk about these 3 pillars of therapeutic engagement. Observation without judgment. So before you put strategies in place, before you design a program, you have to, before you have your goals, you need to understand who we are dealing with. So you cannot support what you have not yet understood. Watch the child, understand patterns. So what comes before the behavior? For example, in ABA, we have what called the ABC strategy of behavior. So there's a behavior, the antecedent, behavior, consequences. So usually you can study the patterns, time of the day, things that are, that could be recurring. Sometimes you're able to modify the antecedent or redirect it. Most times you can change the behavior, sometimes even eliminate it. As simple as some children have behavioral issues, maybe when they come back from school, they're always hyper. Sometimes there may be hunger. Because when you're hungry, you have headache and things like that. What do? You put rest in between. You can even advocate for your child in school where they have snack during the day. As simple as that can reduce behavior sometimes. All right. I don't have time to go into detail. So the question is not what is wrong with the child. The question is, what is the child trying to tell you? What is it showing you? Every behavior is a communication. All right. So number 2, follow the child's lead. Use their world as the entry point. Not talking at the child, but rather engaging with the child. Enter into their world. Use their interest, their strength as a tool. So interest is attention, and attention is the gateway to learning. When you're able to meet them at the need of their interest, you're able to, enter their world and use it, to build other things. That's why I talked about. If a child likes to build, likes to do this, you use it as a tool to teach other things, all right? Relational safety. A child must feel seen before they can grow. So a child does not feel safe, whether physically, emotionally, or in a sensory way, cannot learn. That's why I talked about the senses. For example, imagine you are in a stadium and there's a lot of noise and I'm trying to speak to you. That noise will be distracting. So for some children, they're hypersensitive to noise. When you see them holding their ears, they need head canceling food, because they need to be able to be present to be able to engage, all right? So they need to be able to connect with you as well. So the nervous system I was talking about, sympathetic and parasympathetic nervous system, most of them, there's always a dysregulation when they have the fight or flight movement. That means that little things trigger their sympathetic overdrive. So there are different strategies we can use to manage this, which I don't think I can get into here. That's some of the things, maybe another time, I don't know. So I talked about, okay, a child who builds, for example, go into their world and use it as a tool. Okay, there are different strategies. There's a floor time strategy, where they use like more like a play-based therapy intervention to teach certain things. Then I talked about the relational safety, the REACH framework. I don't have time to go into anyway. So how therapeutic engagement helps us appreciate differences. So without therapeutic engagement, you'll be seeing you will be seeing the behavior. The child is deviant. He doesn't like transition. With therapeutic engagement, because you are individualizing the child, you are seeing communication. Because every behavior is a communication. What the child trying to say, then you can begin to intervene. We see deviance. A deviance can be seen as a dysregulation. So a child is dysregulated. A child doesn't just mean to be shouting and throwing what we call meltdown. Meltdown are like tantrums. Often people mistaking them. They can manifest the same way. So when you see all those videos on social media, people are just saying they should beat the child. I remember a video that circulated one time. They were in a store where they sell electronics, and the child was destroying things. From my expertise, I could tell that most likely the screens were the ones because the child is likely sensitive to light. So they were no gadgets on, all the screens are always on. So that kind of child, if the parent, maybe they didn't know, or maybe it had not happened before, you probably should not have been in that environment. That's the difference between a meltdown and a tantrum. A tantrum, the child is crying, but there's a need. So, for example, the child cries for a biscuit. If you give the child the biscuit, the child will be quiet, because that's why the child is crying. A meltdown is that the child's nervous system has been activated. I talked about the sympathetic and parasympathetic. Sympathetic is the calm. Parasympathetic is the calm. Sympathetic is the flight or flight. If you see a lion and you will run. So for them, little things trigger that sympathetic over there. And once the thing has been triggered, there is nothing you can do, so to speak, just to keep the environment safe. Keep them this thing. Sometimes co-regulation can help. How you regulate your own emotions. Then with time, it will run its course and it will calm down. So what you do most times with a meltdown is the best thing is to prevent it. That's where the ABC comes in. If you study the patterns, what are the things that trigger them, over time you can know. So instead of saying inability, see a different learning style, a different way they learn. Instead of seeing a diagnosis, an individual. Okay? Instead of thinking what is missing, you see what is present that we can use as a strength. Instead of looking at weaknesses, let's build from strength. I'm rounding off now. So move from strength to weakness. And sometimes you just need to build a bridge. So a child who is having difficulty speaking, you can build a bridge using different tools. The picture exchange technique, you can use the AAC device, you can use sign language, you can use gestures or things like that to build a bridge so that you bring down behavior. Because some children, they struggle to communicate, and that can cause behavioral issues. So, and if a child is having behavior meltdown, they can't be present to learn, all right? So a child who is strong in pattern recognition, use it as an entry point to mathematics. You can think of things like abacus, chess, those things, you can use them. A child who expresses better through art, use it as a tool to build a bridge to writing. A child who has whose hands are still developing, teach them typing if they're still struggling to write. A child who tries better with project-based, do project-based learning. And that's why I tell you that parents come in sometimes, you might need to go to school and advocate for your child. All right. These are some of the strategies we often use at Autism. Things like communication. How does the child express their wants and needs? Things like that. Regulation. What are the things that trigger them? And how can you build like we call it a sensory friendly environment. Some of them have sensory processing issues. So sometimes instead of seeing aggression, deviance, find out what are the triggers and things like that. Some of them are also slow. When you ask a question, a bit slow. There are different ways you can begin to build this cognitive speed and all that. Then their learning profile, how do they learn? The kind of memory, the attention span, instead of asking, so you need to ask, how does this child learn best? Although we say most of them are visual learners and all that, even when it comes to being a visual learner, you have to look at curriculum. I don't have time to teach a lot of things, the curriculum types, because even visual learning have different methodologies of teaching. Different subjects have methodologies of teaching. Even when it comes to visual, you still have to look at how the textbook is layered. Some children struggle when everything is so crowded, while some children will do well with piecemeals one at a time. So you still need to individualize the child. You don't just say, oh, all children are visual learners, or a child is a visual learner. That means anything that has a visual learning system. No, because some of them have eye tracking issues. Some of them have convergence issues. They don't actually see so well. So if you are going to teach them even with a visual system, you have to use something that is well laid out, probably bold and easy consumption of concept in piecemeal. So there are different strategies to that. Okay, so like what this looks like in real life, instead of through a label lens to look at, okay, child is seeking attention, beat the child, he's being stubborn, while a therapeutic engagement to look at, you're supposed to think, is the child hungry, is he fatigued, why is he overwhelmed, help the child to regulate. Once the nervous system is calm, the behavior will resolve. All right, and then you understand the signal. Things like a child is not pre-verbal, limited ability. Instead of thinking that child has limited ability and things like that, observe their communication attempt. Okay, can we build a bridge using body language, using picture exchange, using the AAC device, the assistive devices that we use, or different communication techniques. Instead of a child that is struggling to focus, okay, he can't read, or things like that, you assess the visual. Is there an eye tracking issue? Is there an auditory processing issue? Is it a methodology, curriculum? Is it environment? It could be different things. So when we're able to do this, when a child feels genuinely understood, anxiety reduces, behavior improves. Then when parents are able to move from overwhelmed to structured, they're able to individualize their child, exhaustion comes in, hope is restored. And when educators understand that regulation comes before instruction, all right, the classroom becomes a genuinely inclusive thing. And inclusion is not just tolerance. Inclusion means that you're able to customize your curriculum to the style that the child is able to learn. In fact, I've had clients that I tell them that go and tell the school to drop the subject. There's no reason why a child must do the 5 or 6 subjects if he doesn't have the ability. So you can't demand from a child what he doesn't have the ability or the skill. It's like not productive. The child is just there for the 6 classes, not building anything. And always know that parents, that therapy is part of learning. So some parents think that child has to be in all the subjects. No. School put therapy in place. So your child going to therapy in school is actually part of the intervention. And for parents who are doing therapy outside of school, I've had clients say, for your 5 days, do 3 days in full class, 3 days or 2 days, and do therapy. So therapy is part of the IEP and the learning. So parents, please listen. Let me help you. Just leading like, you'll be fighting the teacher. Let me help you. When a parent reached out to me, now in the school, they are doing cooking. I told the parent that, in fact, I love it. The self-help skills. I said, okay, think of your child when he's 25. What is going to be important? So parents with the future in mind. So they know what they are doing. They're incorporating the baking into the counting. So therapy is part of learning in school. It's not different. All right. So when we get things wrong, all these things, the 3 questions, finally I finished now. What is my child trying to communicate to me? Think about it. What is happening in their body right now? Are they regulated or overwhelmed? So what support can we put in place? And most importantly, parents, please learn to partner with the school, partner with the professional. So back to the child I was talking about. His parents were walking, they walked in, lost hope and things like that. What we did was we individualized differences. We didn't think about the obstacles. We didn't think about what he couldn't do. We moved from strength and we were able to help him. Therapeutic engagement gave us the eye to see him. And once we saw him, everything became possible. So every child on the spectrum is not a puzzle to be solved. They're a person to be known. So therapeutic engagement is the art of paying attention well enough to know them. When we get this right, labels become irrelevant, diagnosis become irrelevant, because we are no longer seeing a diagnosis, we are seeing a child. Thank you, everyone. I try to rush through that. Yeah, thank you.
Wow.
Thank you.
See, I need to see fire emoji. Fire. That was powerful. Thank you so much, Dr. Omolola. That was everything. It was giving. I hope you guys are empowered. Please put your fire emoji. I hope you are empowered to know how to advocate for your children. Well done, Dr. Mola. We'll be bringing you back for the panel discussion. So please hang around.
Okay.
Send in your questions.
Okay, thank you once again.
Thank you so much. And right away, we're going to have Dr. Oluwakemi. She's going to come in. We're going to bring her up immediately because we want to respect your time. We know that you have a lot to do, all right? And Dr. Oluwakemi is going to be talking about beyond labels, using therapeutic engagement. Oh, I'm so sorry. We're bringing up Dr. Oluwakemi here. She's talking about beyond therapeutic engagement to appreciate individual differences. All right, Dr. Oluwakemi, are you here? Is Dr. Oluwakemi here? Hello? Oh my God. This thing has frozen me. Okay, can you hear me? All right. Can Okay, I guess I'm back on. All right. So we're going to be bringing in Dr. Oluwakemi to join us right now for our last discussion before we call it a day today.
In the heart of Abuja, Nigeria, Jewel's Leading Light International School stands as a beacon of excellence, deeply rooted in Christian values. Our school offers a rich blend of British, IPCs, EYFS, and Nigerian curricula, ensuring that students receive a globally recognized education while embracing the moral foundation of the Word of God. Our state-of-the-art facilities, from science labs to top-notch sport amenities, are designed to create the perfect environment for students to learn, grow, and thrive. We incorporate the advanced teaching technologies to make learning both engaging and effective, fostering a nurturing space where every child feels inspired and motivated. Jewel's Leading Light is more than just a school. It is a community dedicated to nurturing the trailblazers of tomorrow. We are committed to cultivating the next generation of global leaders and innovators through rigorous academic programs and a Christ-centered approach, ensuring excellence and creativity in all we do. Join us at Jewel's Leading Light International School, where we are dedicated to nurturing the trailblazers of tomorrow.
Awesome. I know this has been an impactful session.
Everyone, Jewel Lights, right?
Jewel's Leading Light.
Jewel's Leading Lights. Good afternoon, everyone. I really want to thank God for the life of my grandson. Joining this school was a big blessing to us as grandparents, and I believe also to his own parents. It was a blessing, and there has been a tremendous, wonderful. Good morning, everyone. Jewel Lights, right?
Jewel's Leading Light.
Jewel's Leading Lights. Good afternoon, everyone. I really want to thank God for the life of my grandson. Joining this school was a big blessing to us as grandparents, and I believe also to his own parents. It was a blessing, and there has been a tremendous, wonderful improvement in his life since he came here. He has improved so well in all his activities academically, behavioral. In fact,
All right. So are we going on to the next speaker? Dr. Oluwakemi Adebayo is online now, and I want to welcome you, ma'am. Thank you so much for joining us. You have the
Thank you
stage.
very much. Thank you very much. Good day, SEND coordinators, parents, caregivers, educators, child advocates. I'm speaking today about the topic from awareness to advocacy, families as champions of inclusion. I stand here today as a mother who has cried, questioned, and most importantly, who have grown. I started with an emergency cesarean section. I was in I gave birth in a hospital, and by the time I woke up, I couldn't find my baby beside me. And I was told the baby was distressed and had been taken to another hospital where he would receive better care. So after 5 days, I met my son. The doctors were not around. I had time to look at him well. And something struck me really hard. And that was the shape of his face. And I told myself, why is his face this shape? No, it can't be the set of people that I think he looks like. So I kept denying it until finally the doctors came and diagnosed him with Down syndrome. It looked as if the earth beneath my feet was shifting. I began to go from one emotion to the other, fear, uncertainty, confusion, and the whirlwind continued that way until gradually I became to settle down with my baby. Suddenly, I had a life in my hands that I was not prepared for. He didn't respond like other children. He didn't cry. He didn't react. He didn't develop the same way as the other children. However, as time went on, we continued to understand each other. I understood that my baby is a life that needed to be understood. He was not a problem to be solved. I was praying, just like the doctor has said, this thing must change. It didn't come to change. He came to stay. And I realized that I needed to understand him. Autism is not a flaw to be fixed. It is a different way of seeing life entirely. He was a happy baby. He could understand the things we were doing. He could understand. He could laugh when we were laughing. He could play. He even started trying to sing along and dance to music. He will move his body. He will move his head. You know, at this point, I began to realize that the family needed to understand him too. It was time to educate my family about the unique difference of this baby. One of my children said he was embarrassed every time they go to appear in public together. And how did I handle this? I continued to educate them about how different he is. He sees things differently. He wants to play. He wants to run around when others are sitting. So we continue to educate each other. And I especially told them what he needs the most is love. Then we add patience, and then we add understanding. When we were leaving the hospital, the doctors didn't tell me to feed my baby. They said, Madam, go home and love your baby. That's the first and most important thing he needs. So I brought my family into this, and we began to love him. I taught them to be patient with him. Just be patient. When you ask him to do something, he doesn't do it, or he doesn't do it the way you asked him to do it, be patient. So we continue up till now. He's 13 years old, and I am still educating my family about some of the ways to handle his unique difference. And what is the role of the family? We are the first teachers, we are the first advocates, and we are the first safe place for these children. We are the champions of inclusion. We include him in all family activities. We don't just put them in front of TV to watch cartoon. If there's house chore going on, even if he will not do it well, we'll give him his part to do. After doing it, I can go back there and tidy it up, but we will do it together. So we include him in family activities. So they feel a sense of belonging, they feel more confident of themselves and of their abilities. If they join the family to sweep, to clean up, and they go out, they are confident that they know how to clean up. They may not do it well, but they are confident that they can also participate in those activities. Our role as a family and being their first champions of inclusion, it means that we choose to see ability where others see limitation. Some people keep these children hidden away. They go out and leave them behind. In my family, we don't do that. We go out together. Wherever it is that we are fit to go, he goes with us. As champions of inclusion, it means that the family must speak hope where fear tries to take over. We continue to speak hope. Not that he will change, but that he will learn the things that will help him to survive in the larger community. As family, we celebrate every progress. When he's learned to sit down, we celebrated. When he learned to stand, it was a big celebration in the family. When he's walking, it was a big celebration. Even if it looks insignificant to others, we learn to celebrate every little progress that these children make. Our role as families does not stop in the family. It goes beyond the family. It goes to the school. Just like the other speakers have said, I will not try not to say what they have said. It goes to the community, the society, the playground, the workplaces. It means we need to continue to work with our educators. They don't have to take all the subjects in the school, but we also should follow up to also know that they are not relegated to one corner, just like Dr. Zainab also said. It means that we should speak up when we see exclusion. My son was in a school where the teacher would say, write, and he didn't feel like writing, he will not write. And she will package all his books and put it in his bag and leave him alone until it was time to go home. So when we get home, all the books and subjects that they have done in the class that the boy has refused to cooperate, I'll meet them in his bag at home. Eventually, I withdrew him from that school. So it is important that we work closely with those who work with our children. Sometimes people say inclusion is difficult or too costly. Yes, it's true. However, I say exclusion is more costly. Exclusion is more costly. Although inclusion appears costly, the higher investment associated with integrating children on the autism spectrum into mainstream school largely reflects the need for specialized support. So we look at the specialized support needed for these children and we think it is too costly, and sometimes we may be tempted to withdraw. If we withdraw, I think allowing them paying the cost for inclusion is cheaper than paying the cost for exclusion. I remain grateful to one Reverend sister. I first took him to, when I saw that he was singing along with cartoons, I took him to a special needs school in the FCT. But the Reverend sister looked at him, looked at how he blended with the class, and said, Madam, take this child to a mainstream school. Take him to where he will see challenge to come out of where he is. I'm forever grateful to that woman. It has been a journey of trust, it has been a journey of growth, and it has been a journey that has prepared us for the future. We have encountered challenges. Before I go to the challenges, I want to say that it is important that we prepare them to survive in the society. One day, my son went to school in the morning, and by 2 p.m., someone called me, actually my tailor. She called me, she said, Mommy Zuriel, where is Zuriel? I said, Zuriel is in school. She said, Zuriel is in my shop as I speak with you. Her shop is like 500 meters away from the school. You know, I was shocked. I called the school, where is Zuriel? They say he's in his class. I said, no, he's not in his class. They looked, and truly, he's not in the class. And she asked him, where are you going? He said, he has some speech. Like, I'm going home. Do you know the way home? He said, yes. And home is very far. And so my tailor said, sit down. And we eventually went to pick him up. What did this teach me? You know, children were living at an earlier time, and somehow he escaped the teacher and left with those set of children, thinking that Zuriel was still waiting to close at his own time. It taught me that Zuriel was trying to be independent. What did I do? I began to rehearse with him by putting, the first things I tried trying to do was to put small amounts of money in his hands. And I would say, go to the corner shop, go and buy this and that. And he will go. Sometimes he will buy what I say, sometimes he will buy what he feels like buying, but he will go and he will come back. I started teaching him how to cross roads, because if that lady hadn't seen him, there were many roads to cross. Even if he knew how to get home, there were many roads to cross. I started teaching him how to cross roads. He has not gotten it yet, but I started teaching him how to survive in the society. I take him around the environment where we live, the streets around where we live. He knows where we are going. We are going to social place. And he will say, when we get to a turn, he will say, this way. When we get to another turn, he will say, this way. All in a bid to teach him, to equip him to survive the society that he will finally find himself, whether I like it or not. I also have begun to think of skill acquisition for him. And it's important too. Other speakers have mentioned it. Not just, he does not read, he does not do sciences, he does not do social studies. No, he only does reading and writing, coloring, and if there are crafts, he participates, but he's in the classroom and they embrace him. Thank God for the environment, the school where we eventually got for him. They embraced him. In fact, everybody knows him in the school as if he's a child of the owner of the school. So I started thinking of skill acquisitions for him. However, we don't have a final grasp of this yet, but we have begun to do this. Now, I want to go into the challenges of inclusion. To be honest, the journey of raising Autistic child is not easy. Number one, it is exhausting. I'm sure we all know that it is exhausting. And there are days of financial strain. The financial strain is so discouraging that some people prefer to keep them at home. I know of a child, of a woman, she's a woman, she's now in her 50s, and by the time her family looked at my child, looked at the things he could do, looked at the many things I have exposed him to, and they say, oh God, why did we keep our sister at home? The cost of exclusion is far greater than inclusion. So let us bear the financial strain that inclusion comes with. There are days when progress is slow. There are days when progress seems invisible, in fact. So these things are challenges. It results in sometimes depression, exhaustion of the mind and body. There are days when the society does not understand why your child, our children, are behaving the way they are behaving. Sometimes the hardest part is not the autistic condition itself. It is the lack of understanding from the society, from the world around them. We can't be with them 24/7. They have to mingle with the society. I want to appreciate members of the society, members of the church, members of family, friends. I just have a group of people that I personally refer to them as angels in waiting, who embrace him, who look out for him, who love him, because I can't do it alone. So I have a group of people like that. When we advocate for these children, we are not advocating for special treatment. Include them in everything that is being done. Don't sideline them. We are asking for the world that values diversity in all its forms. We're asking for the world to embrace them. Gradually, in my family, we moved from just focusing on the boy Zuriel. We began to feel a strong pull for other children like him. We have some deaf, some who are lame, just other disabilities. We began to reach out to them. What started as a simple desire, we called them together. We had an end of year party for them, and you could see the joy in these children. And another set of people that we were able to reach out to with that step was their parents. It's not only the children that are being excluded, even the parents too have no time to mingle many times. I listened to a woman who said she went for a party and was given a table. She sat on the table and everyone on that table got up. So the parents too are sometimes facing exclusion. So at this event where we brought these children together and their parents, we could see we were happy with the joy, the reaction we got from them to be specially celebrated. And this is what we want the society to do for our children. From that experience, a deeper vision of advocacy began to form again. All the steps we have taken, my entire family went along with it. We began to discuss the idea of establishing a center where these children can be equipped with practical skills that will support their inclusion in the society. The other guest speakers have spoken of typing, have spoken of cooking, and I've mentioned a few too that I have begun to practice with my child. So we began to think of this. And this is where we are right now, because we all brought our voices together and believe that they should be seen, they should be valued, and importantly, they should be empowered and not hidden away or overlooked. So as families, all of us, we have the unique power to change perceptions of the society concerning them. I want to encourage us to share our stories of our autistic children. I've put my own story in a book. I titled it Meet Zuriel. I have put my own story in a book. By doing that, when we share our stories, we humanize autism. We let them know that they are not to be hidden away. They are not something or people to be ashamed of. By challenging stereotypes, we dismantle barriers that are raised by the society. And by standing together, parents of children on the autism spectrum, by standing together like this, we amplify our voices so that people in the autism spectrum cannot be ignored. And I'm concluding now. I conclude by saying that inclusion benefits everyone. It benefits everyone because when people begin to embrace them, empathy grows in the society for them. We teach future generations that differences are not divisions. They are opportunities to learn from one another. So our children are learning from them, and they're also learning from our children because they have their unique differences. They see life differently. We can learn to see life differently by associating with them. So let us build society that are safe for our children, that are valued, that they can be valued and celebrated. And let us never forget to stand for inclusion. We are shaping a better world and a kinder world for everyone. Thank you very much. God bless you.
Good evening, everyone. Can I be heard? Please let me know if I can be heard. All right. Yes, I can be heard. Awesome. Thank you so much. Wow. Thank you so much, Dr. Oluwakemi. That was amazing. Thank you, thank you, thank you. So, right now, we're going to begin our panel discussion. But before we go, I hope this was valuable. Please put it in the comments. I hope this was super valuable to you. All right. I am like they have all rightly said. For example, I work with children on the spectrum at my wellness center. And I can't tell you enough how much that inclusion matters. When you have parents that are doing the work, it is completely different from parents that just want miracles to happen. We have seen children begin to speak, children begin to make eye contact, children begin to do mental math. I mean, the miracles they abound. All right. So I want to encourage you. Don't like one of the speakers said, autism is just a signal. It's just telling you what exactly that child needs. It's not a stamp. It's not a final destination. It's not a dooms, whatever. No, it's just a symptom. It's just something that tells you this child needs extra support. So I want to welcome our panelists right now. I want to welcome our panelists online. Are they in the room? Let's give a round of applause to our panelists. Thank you. Where is Dr. Zainab?
Dr. Zainab.
And where is
And where is
Mrs. Oluwatoyin
Mrs.
Obo?
Oluwatoyin Obo?
Dr.
Dr.
Oluwakemi, where are you? All
Oluwakemi,
right.
where you're
Awesome. So I want to say thank you so much. This has been very enlightening. I mean, I've been taking notes and we have some amazing questions for you. This has been one of the most enlightening conversations we've had because the truth is, our children are not children that need to go and be locked somewhere or need to be ashamed of, children that need to be hidden. No, they belong in society. They are capable of amazing things. So I'm going to go first to Dr. Zainab. Um, in a typical Nigerian classroom with limited resources, what are three practical steps a teacher can take immediately to make their class more inclusive? Did I lose Dr. Zainab? All right. Can you hear me, ma'am?
Yes, I can hear you loud and clear. And if I got your
Awesome.
question correctly,
All right.
you're asking
Go
what
ahead.
practical steps a teacher can take to make a class more inclusive, right? Can you hear me?
Yes, we can hear you. We can hear you, Dr. Zainab.
No, don't.
Okay. So until Dr. Zainab comes in, let's go to Dr. Oluwakemi Adediran. All right. Let's go to Dr. Kemi Oluwadediran. Let's see. I want to ask you this question. What are simple ways parents with neurotypical children can also promote inclusion at home? Just give us simple methods, simple ways to get all the children doing things together.
Okay, thank you. Can you hear me?
Is Dr. Oluwakemi here?
Okay.
Can you hear me?
Yes, yes, I can hear you. Okay. One of the examples, is it at home or in school? If it is at home, whatever activity we are doing, if it is gardening, I ask him to join us. He takes the hose, he waters plants, he takes the broom, he sweeps, even though he will not do it well, but he does it. And in school, he's not excluded from the playground. He's not excluded from whatever rehearsal his classmates are doing. They participate together. He's able to walk by himself. He's able to do a number of things on his own. So it is easy for him to mingle. And he does that very well in school. Also at home, he does that well too. And when it is time to go around in the neighborhood, we go out with him. We do all activities together. Even at home, he's even taught how to stay alone at home, how to be alone by himself, how to keep the door. Though not for a long time, but just to teach him some of these things that he's definitely going to meet one day when we are not there. So we make him do it when we are there, and he does it. He cooperates. Any day he doesn't want to, we just let him be, and gradually, patiently, he joins us. We include him in most of the things that we do. I also mentioned about walking around the environment where we live. He's familiar with the streets. He's familiar with the turns. He on his own will say, this way, this way, this way, until we get to where we are going. So those are some of the examples of what families can practice to include them in everyday activity. Thank you.
Okay, I'm so sorry. My network threw me out, but I'm glad to be back. All right, I'm going to be moving on to the next question. Thank you so much, Dr. Oluwakemi, for answering. Our next question is for Dr. Zainab. In a typical Nigerian classroom with limited resources, what are 3 practical steps a teacher can take immediately to make their classroom more inclusive? Over to you, ma'am.
Okay, thank you, Modupe, for moderating so nicely and for that question. So, like I said during my presentation, that actions can be small, and we've talked about some of the barriers to inclusion as limited resources. But like Dr. Lola already said, first and foremost, you have to identify that child first, what their learning style is, what their limitations are. So after doing that, then you now try to implement the type of style of learning. So be it visual aids, be it storytelling or hands-on, activities, whatever that learning style is, peculiar to that child is something you want to implement. And also what I want to see more in terms of what teachers do in classrooms is, and I think the schools that are inclusive are already doing that, is creating a safe space for the children to learn. So I mean, some children, little human beings can be mean sometimes, and not because it's coming from a place of hate, but because they don't really know any better. So teaching the children around that child to be more empathetic, to create so no bullying, no making fun of the child, trying to carry everybody along. So when you go to the inclusive schools, you realize that all the children know that, well, some of the students in that school are special and they need extra help, or they need some type of guidance, just making and then creating, modifying the classroom in such a way that if a child, for instance, in trying to identify the challenges, has sensory issues, maybe to sound or to, so if you're going to do anything that involves like noise or something, you have to modify it so that that child is not affected. Be it noise cancelling headphones, or something like that. If the child has sensitivity to maybe lights when you're doing, sometimes you play videos in class, if they're going to be flashing lights, just having that child in mind so that anything you're doing, that child is, you will now say, oh, he doesn't like bright lights, so we'll exclude him from that presentation. Rather, you remove certain things so that that child is included in everything in that classroom. So it's just modification all the way. But first, you have to understand the child.
I love that. I love that modification, but first understanding. Thank you so much, Dr. Zainab. Thank you. For Dr. Omolola, I'm going to ask you this question. How can a teacher shift from a label-based approach to a strength-based approach in the classroom?
Okay, thank you, Modupe, once again. So what I would always say is this, like I talked about, everyone has a strength.
Are you
And
muted?
strength may not... No, I'm not muted.
Okay, you can hear
Dr.
her.
Zainab, can you hear me? Okay,
Loud and
so
clear.
I always say something. Okay, thank you. So in terms of moving to strength-based approach, everyone has a strength. So what the teacher should do is this: identify who the child is and their uniqueness. So what you can do is this. For example, I had a client who was saying that the teacher was saying that the boy was always distracting in class. And I told the mother something, and I've seen it over and over, that something is wrong. The teacher is not including the child. Other children are not also playing with the child. So how can you move to a strength-based approach? Include the child. So depending on the kind of child the child is, some children get distracted, want to move around, what do? Enlist the child in what you're doing. So even if the child is pre-verbal or non-verbal, as simple as standing as your assistant teacher and holding the flashcards, you are doing something, and most of these children, how children are exaggerate. Maybe he will be the assistant teacher to even hold your colored marker. He stands beside you. So that way you are avoiding him just sitting down and just shaking his head or pushing somebody. Do you understand? Another thing you can also do is this. I always teach parents a strategy that as simple as a child wearing a very nice shirt that has, something attractive that other children will be wondering, what is this? It can be the character of the day. He can be, depending on the child's ability. A child that can play an instrument, for example, and you're doing something about music, let him play the instrument while the other children are doing the talking. Other things like, some children have sensory environment that they have to wear what they call a calming vest. So anything, or even noise cancelling headphone, I would always advise that as much as possible, if you can get duplicates of certain things so that the child doesn't look different, you can enlist it into your strategy of teaching. So the other children are not wondering that, why is it so different? Of course, depending on the class. So you can use what seemingly is a disability to be something that is normal. So imagine all the children wearing like a vest that looks like a calming vest, and we're all doing something that we're dramatizing. They won't be looking at the one child like, why is he looking so different? Or even noise cancelling headphone. We can enlist it to teach different things. That is a strength of that child. Do you understand? So depending on the child's ability, a child that is distracting other people, enlist the child. I tell parents that if a teacher, one parent will tell me that immediately after the assembly, as they're getting into the class, the boys start. I told the parent, go and advocate. If once you are entering the class, the teacher just start, just do one activity. Make him the assistant, go and get the bottles, show the A for whatever, or write on the wall, little things like that. It makes him feel empowered. He's not distracted. But for the calm one that nobody is enlisting, during your circle time, you can do activities that you make all the children engage with that child. Turn-taking activities, flashcards. The child is not left in. So their little ability, they can hold Legos. Their little ability, they can pour water. Use that thing to create your lecture, your demonstration. That shows that you're moving from the child's strength to that is incorporating generally. Then individually, customize your curriculum. That's what I'm talking about, individualizing. You can teach something using auditory, visual, kinesthetic, manipulative. So crystallize whatever you're teaching. Then in cases that you cannot do that, replace the subject with something else. What other children are learning something, let him go for his music class. Let him take his break and go and do his piano, his music lesson. Let him run around the whatever. Let me go and take a run around the field or something and come back to the class. So that's how you move from the strength. So depending what you're trying to achieve, if you still want him to learn or build those skills, teach it in another way. But most times I don't like you individualizing the child. I like you creating an activity in the class, a cooking activity to teach counting and whatever, so that all the children don't start looking at the child differently. We are all doing the same thing, and that child is learning at his own pace, using his skill. Then if he has like maybe a photographic brain and he can draw more than other people, highlight it as a strength and celebrate it. Thank you. You're muted.
Thank you so much. Thank you. Is Miss Oluwatoyin Ogo here, or should we go on to one last thing? Because of time, we want to respect everybody's time. What is one action you think every participant should take immediately after this summit? Oh, are we done?
Okay, thank you very much, Mrs. Modupe Ayebuse. Thank you so very much. Our wonderful speakers. It was such an insightful and educative session we've had tonight. Our notepads are full, and we ensure that our listeners would put into everything they've learned today into action to help our learners with special needs. All right, so this is a call for you to register for the 2 days intensive master class. Yes, the flyers will be displayed on the screen shortly. So this master class would help to equip, empower, and transform how we support our children. And the beautiful thing about this master class, it's not just limited to send um, parents and of course the educators. This is a very big thank you to all our speakers for your time. We appreciate you. Please do well to register for the 2 days virtual masterclass. The theme is From Struggle to Strength, Empowering Every Child to Succeed, from the 21st of April to the 25th of April this year. Please do well to register and ensure you reach out to the contacts, the phone numbers displayed on the screen for more inquiries. Thank you very much for your time. See you same time. Of course, we'll communicate effectively the next virtual session we'll be having. We believe you had a nice time with us. Thank you for joining us and have a beautiful night. Thank
I never
you.
knew as a first-time mom that he was diagnosed with autism, ADHD. Precise. Good morning. My name is Mrs. Choma Charles Abel. I'm Chibueze's mom. I just want to say how far Chibueze has gone, his progress reports from Juice Leading Lights Academy since 2015. Chibueze, I remember when I had him, I never knew as a first-time mom that he was diagnosed with autism, ADHD, precise. The school called my attention to it. That day I was devastated, but Mrs. Obor was able to calm me down. So since then, his progress report has been fantastic. A lot of milestone changes. Chibueze never used to have a good eye contact, but now he's very good. His eye contact is very good. He stopped diapers, his potty training, everything is perfect. And all with the help of the school and God. His speech is coming out a little, which we believe with time God will perfect on. I also want to appreciate Mrs. Obor. I also want to appreciate the educators, the therapists. They have really been doing a good job.
In the heart of Abuja, Nigeria, Jewel's Leading Light International School stands as a beacon of excellence, deeply rooted in Christian values. Our school offers a rich blend of British, IPC, EYFS, and Nigerian curricula, ensuring that students receive a globally recognized education while embracing the moral foundation of the Word of God. Our state-of-the-art facilities, from science labs to top-notch sport amenities, are designed to create the perfect environment for students to learn, grow, and thrive. We incorporate the advanced teaching technologies to make learning both engaging and effective, fostering a nurturing space where every child feels inspired and motivated. Jewel's Leading Light is more than just a school. It is a community dedicated to nurturing the trailblazers of tomorrow. We are committed to cultivating the next generation of global leaders and innovators through rigorous academic programs and a Christ-centered approach, ensuring excellence and creativity in all we do. Join us at Jewel's Leading Light International School, where we are dedicated to nurturing the trailblazers of tomorrow.